Acrophobia is a type of phobia characterized by an intense and unreasonable fear of heights. People who suffer from acrophobia may experience anxiety, panic, or even physical symptoms when climbing heights or being in high places. People with acrophobia may avoid situations involving heights and take steps to avoid going to heights, such as avoiding rooftops, observation decks, or stairwells. This can include rapid breathing, sweaty palms, shivering, dizziness, nausea, and even loss of consciousness in some people. Agoraphobia is a phobia characterized by a fear of open or public places, as well as a fear of situations from which it is difficult to escape or where help may not be available in the event of a panic attack or other problems. People with agoraphobia often avoid places where they may feel defenseless or trapped, such as crowds, vehicles, shopping malls, or open spaces. Agoraphobia can be accompanied by physical symptoms of anxiousness, such as rapid heartbeat, sweating, trembling, dizziness, nausea, or even panic attacks. Arachnophobia is a type of phobia that is characterized by an excessive and unreasonable fear of spiders or spider-like creatures. People with arachnophobia may experience intense anxiety or panic at the sight of spiders, even if they are at a considerable distance or in a safe environment. People with arachnophobia experience excessive fear of spiders, even when they realize that these creatures may be harmless or not dangerous. Arachnophobia can have a significant psychological impact on a person's life, limiting activities, causing depression and anxiety. Claustrophobia is a type of phobia that is characterized by an excessive fear of enclosed or confined spaces. People with claustrophobia may experience anxiety, panic, or even physical symptoms when in rooms where they feel confined or cannot easily leave. People with claustrophobia experience fear or anxiety in small spaces, such as elevators, cramped hallways, buses, airplanes, or any other place where they may feel confined or unable to move freely. Claustrophobia can be accompanied by physical symptoms of anxiety, such as rapid breathing, rapid heartbeat, sweating, dizziness, nausea, trembling, and even panic attacks. Glossophobia is a type of social phobia characterized by an excessive fear of speaking in front of an audience or speaking in public. People with glossophobia may experience intense fear or anxiety when they have to speak in front of a group of people, even if it is a small audience. People with glossophobia experience intense fear of speaking in front of an audience, even if it is a simple introduction or greeting. Glossophobia can have a significant psychological impact on a person's life, causing stress, low self-esteem, depression, and social isolation. Germaphobia is a type of phobia characterized by an excessive and disproportionate fear of infection, dirt, bacteria, or the possibility of contamination. People with germaphobia may experience feelings of anxiety or even panic when they come into contact with objects or surfaces they believe to be dirty or contaminated. People with germaphobia may experience excessive fear of bacteria even if they realize that their fear is disproportionate to the actual threat. Germaphobics may be overly concerned about the cleanliness and sterility of their environment, avoid contact with dirty surfaces or objects, and frequently wash their hands or use antiseptic agents. Emetophobia is a phobia or excessive fear of vomiting or the fear of vomiting oneself or seeing other people vomit. It is one of the most common phobias related to health and illness. People who suffer from emetophobia may have an excessive fear of vomiting, either their own vomiting or that of others. People with emetophobia may also experience fear for their health and worry that vomiting could lead to serious illness or death. Trypanophobia is a pathological fear of injections or needles. People with this phobia may have an excessive fear of medical procedures involving needles or syringes. People with trypanophobia may experience intense fear or anxiety before being given shots or injections. They may avoid going to the doctor or medical procedures that involve the use of needles. In some cases, trypanophobia can cause panic attacks or physical discomfort at the sight of needles or syringes. Kleptophobia is a pathological fear of theft or fear of being accused of theft. People with this phobia may feel restless and anxious when in an environment where there is a possibility of theft or when they suspect they are being accused of theft. They may avoid situations that may involve theft, such as stores or crowds where there is a possibility of losing control of their belongings. People with kleptophobia may be constantly suspicious of others and suffer from a constant sense of distrust of others. Sociophobia is a pathological fear of social situations and socializing with other people. People with sociophobia may experience excessive fear of social events, meeting strangers, or even normal everyday situations that involve interacting with others. People with sociophobia may experience excessive fear of social events, including parties, social events, gatherings, or even just interacting with others. People with sociophobia may suffer from social isolation due to their fear of socializing with others, which can lead to a decreased quality of life and depression. Subscribe to the channel and suggest your ideas for the next video in comments.